I'm Jerry Anderson, and I'm very honored to be chairing this final session for reasons which I think will be clear in just a moment or two. Last year, I had the privilege of working with the Commonwealth Fund on a grant trying to identify programs that are successful in taking care of the high-need, high-cost patients. And I'm not going to try to summarize the results of this study because it would go on for a while, but I just want to highlight one finding to you, and which is the reason why I'm so honored to be on this panel and the last panel that we had. So the first thing we did was we looked at about 300 peer-reviewed publications that had looked at programs to deal with the high-need, high-cost population. And what we found was, first of all, as you all know who try to publish papers, is if you have a negative result or an insignificant result, it's really hard to get something published. So we looked at these 300 publications, and we found, and then we asked, were they able to do anything about the triple aim? Were they able to control costs? Were they able to improve satisfaction? Were they able to improve outcomes? And what we eventually found is, of the 300, only about 50 of them were successful in one of the triple aims. Not 2 or 3, but even just one of the triple aims, so 1 out of 6. And then we went back because we said, well, you can find only a certain amount in a peer-reviewed publication. We wanted to talk to these people that were successful. And what we found was 3 years later, after the study had been published, only about half of these programs still existed. So 1 out of 6 are successful, and of those that are successful, 1 out of 2 are still around 3 years later. So essentially what we wanted to do was to get the people that were successful, which is the last program and this session, to talk to us about what they are doing right and how they're able to provide sustainability. So what we're asking this panel to talk about are applying models of care to in diverse circumstances, how you spread the care models in diverse settings, and how you do it for diverse patient groups, which follows on a lot of what we talked about this morning. And then the meeting goal is to how can lessons learned from past experience with high-need patients be amplified and spread effectively, which is the whole issue of sustainability in these programs. So with that, and given that we have limited time and 2 of my panels need to leave before right at the scheduled ending time, I want to just go on very briefly and just say we have 4 panels. We have somebody from industry, we have somebody from delivery systems, we have somebody from insurance, and we have somebody who's an evaluator. So we've got sort of a whole variety of different aspects of this issue covered. And with that, Don, if you would get started and get us excited.